So Jody, I wanted to talk with you about your tooth on the upper right. You've got a first molar up there, very important chewing tooth. It's had a large metal filling in there for a long time. And what's happening is you're getting some cracks and decay around that filling, and that tooth is at risk of breaking or starting to hurt. And I want you to be able to keep that tooth for life. So here's what I'd recommend. I'd recommend that we do a build-up and crown on that tooth. And we can take care of that very quickly this afternoon. If we don't do anything, the chances of that needing a root canal or extraction are very high. So Jody, what questions do you have for me?
I think I'm good. No questions right now.
Okay. Well, I'm going to pass you off back to Sydney. She's going to take it from here, put the treatment plan together, and go over that with you. And she'll be glad to answer any questions that you have. And don't hesitate to reach back out to me if you do have further questions or discussion.
Okay.
Otherwise, appreciate the opportunity. Have a wonderful rest of your day.
Thank you very much.
All right, see ya.
Have a good day too.
Bye.
Okay, Jody, this is the treatment plan that Dr. Davis discussed with you about that tooth on the upper right that has that old filling in it with the fracture and the recurrent decay. So this is the buildup part, and this is the crown part. So once we remove the old filling, then we have to fill it back in. So we're gonna put the buildup in there so your new crown has something to hang on to. So this is the tooth number, this is the upper right, this is the fee, this is what insurance is estimated to cover for you, and then this would be your portion right here. What questions do you have for me?
Insurance doesn't pay very much, do they? Is that normal?
Unfortunately, some insurances in the plans, they just don't have your best interest in mind versus what the tooth actually does need for treatment to restore it.
Okay, so my part is
This part right
Okay.
here, yeah.
And do you ever do those in a couple payments? Or?
Yeah, we do. You can pay half at the time that we prep the tooth, and then you'll leave with a temporary crown that day. And then you come back in about 2 weeks to get your permanent one put on, and then you could pay the remaining half if you'd like.
Okay.
How's that sound?
Yeah, that'd be good.
Great. If you will sign this, the saying that I went over it with you, you're not committed to the treatment, it's just saying I reviewed it with you. Perfect, thank you. And then Dr. Davis mentioned that he could do it today. We have time. Are you available? Would you like to stay and get that done today?
Yeah, I could probably work that out.
Okay, great. Well, let me let him know, and I'll get you on the schedule, and we will get a few things set up, and then we'll get started.
All right.
Okay.
Thank you.
Okay, Jody, what questions do you have for me?
Does it hurt?
So our doctors are very gentle, and we actually use a numbing gel that is made at a pharmacy, so it's very strong. So no, not a lot of patients feel any pain.
Okay.
Any other questions?
I guess that's good.
Okay.
No.
If you'll sign this for me, this is just stating that I went over it with you. Thank you. And then we can go ahead and get you scheduled. Do you prefer mornings or afternoons?
Afternoons. I work till 4.
Okay. So the doctor sets aside specific times for this type of procedure. So we have, we do have a spot in the afternoon. The latest we could do is 2 o'clock, but we could do the crown seat appointment at 4.
Okay.
Would 2 o'clock work for you?
Okay. Yeah, that'll be fine.
Okay, we'll do 2 o'clock on April 10th if that works, and then we will do your crown seat at the 4 o'clock appointment, so that's more convenient for you.
Okay.
Okay.
Sounds good. Thank you.
Okay, Jody, do you have any questions for me?
Really nervous about this. Is that normal? Is
Yeah.
that, I mean, I don't like going to the dentist.
Yeah, a lot of patients feel that way, and they found that our doctors are very gentle. We also offer the nitrous gas, if you're okay with that, and they're very conservative with their treatment, and they don't do anything that's unnecessary.
Okay. Well, that sounds reassuring.
Okay.
Good.
If you don't mind, if you'll sign this for me, this is stating that I went over it with you.
Okay. Okay.
Okay.
Sounds good.
Okay, Taylor, today we have Jody here, and we have finished with the crown and build up on number 3, and she's scheduled to come back to get her permanent crown seated and the decay taken care of on number 14.
Wonderful.
So I'm gonna go ahead and hand this to you.
All right, thank
And
you.
Jody, Taylor, we'll get you all taken care of, okay? It was nice to see you. Hope you have a great day.
Thank you so much. Awesome. All right.